Wake at night frustrated because you can't go back to sleep? Well, here to tell us more about insomnia and treatment using cognitive behavioral therapy is Nurse Christina Paris. Good morning, Nurse Christina. How are you doing today?
Hi, I'm doing good.
Good. Thank you for joining us.
Yeah.
So, is insomnia simply not being able to sleep, or is there more to it?
Pretty much that's it. Now, it's different for everybody, but it's difficulty falling asleep, staying asleep, or waking up at night and not being able to get back to sleep. And it affects about 10 to 15% of the population.
Gotcha. So what are the symptoms of insomnia?
So again, you're going to have a difficult time falling asleep. Not me. I'm out in 3 minutes.
Jealous.
Some people just don't sleep well. Many of us, I'm the one that wakes up in the middle of the night and can't shut my brain off. So I can go to bed quick, but sometimes I wake. Forgetfulness, difficulty concentrating if you're sleepy during the day. If you're worrying about things, you might be kind of crabby, you may be less motivated to do things because you just don't have the energy. And ongoing worrying about sleep. So we get that. That's a frequent complaint, especially as people get older. We have our patients that will call in and say, I'm done, I can't sleep, I'm tired of this, I'm exhausted, I just am not getting the rest.
Gotcha. I've been through those days before, and it's easier to say like, oh, just go to bed early, or turn your phone off or something like that.
Right.
But, what are some ways that one can sleep better that are suffering from insomnia?
So, there are medications you can try if it's just something that is episodic. So it's just happening because of something going on in your life. But if it's more chronic, we look to things like cognitive behavioral therapy. So if you think about the way we think, it's really, that's what it is. It's changing the way we think. It's kind of interesting. I was telling my husband, I said, on the weekends, I love to nap. And when it comes noon on a weekend, I can hardly keep my eyes open because I'm so sleepy. So my body is conditioned to do that. Now, I don't fall asleep at work. I'm not sleeping during the day, but why is it on the weekends? It's because my body knows that on the weekends it's time to sleep. So what cognitive behavioral therapy does is it kind of changes your conditioning. It changes the way you think about sleep. You want to have an activator like your poor sleep. You want to change your belief, and then the consequences. You want to change those too. And how we do it is we use sleep education, sleep restriction, which restricts the time you go to bed, so that you go to bed when you're tired, instead of going to bed and thinking, I'm going to lay here until I fall asleep. That just doesn't help, and it only makes you more frustrated. Now, sleep restriction can be really exhausting and frustrating in the beginning. People might think, oh, this isn't working, I'm just more tired. But if you stick with it, it can help. And stimulus control, as you talked about, reducing the time on your phone at night, reducing anything that gets you anxious or up. You want to control that. If you wake in the night and you aren't sleeping, they say get up. Get up and watch something like, I like the Hallmark Channel because it's not stressful, there's nothing to it, it's pretty mindless, it's kind of relaxing. So find something, don't get up and watch, no offense, news, watch news in the morning, don't watch it at night when you're trying to sleep. And sleep hygiene, things like limiting alcohol, tobacco intake, things like that are all things that you want to do.
Very interesting to learn more, and I know I may suffer from this because of the weird sleep schedule. So are people, real quick, are people that work third shift or night shift, are they more prone to it?
Absolutely, they are. And really the only way to avoid that or change that is to get a different job. But we don't want you to leave, Kevin, because we like having you here.
Well, thank you, I appreciate that.
Yeah, it's tough, but really going in and seeing a therapist if you have chronic. There's also a lot of apps too. There's the Headspace app, which can help you sleep and give you different things, meditation. And the VA has a free app on their VA site. It's free to anybody, and it's called CBTI, those
CBTI.
initials. Yep, CBTI for cognitive behavioral therapy.
All
and
right.
those things can help you.
All right, well, I appreciate you coming in today. Hopefully we can all get some better sleep out there. But thank you for coming in, and we'll see you again next week.
Awesome, thanks.
Yep.